Everybody see the slides?
Yes.
Okay, perfect. So thank you everybody for coming today. We're gonna go ahead and get started. This is the first kind of kickoff meeting for the 2022 Healthy Capital County's CHIP cycle, so our Community Health Improvement Plan and Improvement Process. So we have just moved out of our the assessment phase, and we're starting to kick off and getting into this next part. First, I'd like to say thank you to everybody who is involved and who in the assessment phase and going forward into the CHIP. So everybody from the health departments, from Mid-Michigan District Health Department, Ingham County, my colleagues here at Barry-Eaton, McLaren, Sparrow, and Eaton Rapids, and Planning Commission, and CAHA, and Community Mental Health. You guys have all been super helpful in helping us throughout the whole process. And we are so thankful that you guys are willing to help us even more going forward, moving into the CHIP process. A little bit about what we're going to do today. So the first thing is just to get everybody on the same page as who we're going to be talking to. So I will be asking our, on the next slide, our coordinating team members to introduce themselves. So these will be the folks that, so it'll be one person from the local health departments, and then it'll be our priority area lead, just because we have so many other people. In the meantime, when we're doing that, if you are not one of those folks, just feel free to introduce yourself via chat, so everybody has a sense of who's here and who's participating today. After that, we'll be doing just a little bit of a quick data review, just from the things we have from the report, to get kind of everybody on the same page if they haven't seen the data before we start talking about the CHIP and the things we've done in the past, our success stories from the previous cycles. So we have two speakers who will share their quick stories of what they did based on last cycle's CHIP. After that, we'll go through and start to discuss the goals and objectives for the 2022 CHIP. So we'll be doing breakout rooms for that. We will have 4 different breakout rooms, and we will, there'll be a slide that tells you guys which ones to go in. And that's where really our discussions will take place, and where I hope to spend the bulk of the time today before we come back to the big group and wrap up and talk about kind of what the process and the future meetings that we'll have from here. So this is where the coordinating team is going to introduce themselves. So I will go first, and then we'll kind of pass it around. So I am Chris Chester Hughes, for anybody who doesn't know. I am the health analyst at Barry-Eaton District Health Department. I have been coordinating the Healthy Capital Counties project through the assessment phase that kicked off December of last year. This project is kind of my main focus right now. And in the past, I've also done some COVID data work and things like that. But for now, I'm mainly focused on this work, which is great. And so, Marianne, I saw you on there before. So would you mind introducing yourself?
Sure. I'm Marianne Ford. I'm here on behalf of the Capital Area Health Alliance. If people aren't familiar with the Alliance, it's a regional organization covering Eaton, Clinton, and Ingham counties, and has worked on a variety of issues from healthy lifestyles to healthcare data exchange over the years. Right now, the current areas of focus for the Alliance are whole person care, health equity, and readiness for practice. So we have a workforce to provide whole person care. So that's my story.
Thank you. And Marianne will be working with me on the access to healthcare piece. So you'll be seeing us in the breakout rooms later if that's what you're here for. For affordable housing, Janine, would you mind introducing yourself?
Yes, I'm Dr. Janine Sino-Junudi, and I work for Ingham County Health Department as the health analyst and healthy communities coordinator. And I've been coordinating the process, the CHIP process for, this is the 3rd cycle. And this time I will be sitting also in the affordable housing priority area with Rachel Elslinger. Can you, Rachel, introduce yourself? From Tri-County Regional Planning Commission. She's here, I don't know.
Going through. I don't see her, so if she joins in later and we have some time, she can introduce herself then.
Okay.
So then we'll move on to Paige from Ingham County. Could you introduce yourself?
Good morning, everybody. I'm Paige Barkowiak from Ingham County Health Department. I'm a policy analyst over there, and I will be leading the community safety priority area for our CHIP.
Thank you. Joel, would you mind introducing yourself for the behavioral health section?
Sure, Chris. Good morning, everyone. Joel Hefner, Prevention Outreach Coordinator for Community Mental Health Authority of Clinton, Eaton, Ingham. Also the Behavioral Health Priority Area Lead. I also facilitate the Behavioral Health Council that operates in the Tri-County area and has an action plan that we'll be aligning these two processes with as we've done in the past. Thank you.
Just going through my list. I think that's everybody I see so far, so we can move on to talk about kind of the process as a whole. So this is kind of a good little graphic that gives you an overview of what our assessment and then CHIP cycle look like. So the portion we've created there is the darker color. So we've done the data poll and the data analysis. We've had our meetings and connected our focus groups. And through all that work, we eventually came through our prioritization process, which I'll talk about in a minute, which we selected our priorities, which then now feeds into the CHIP portion, is how we get our goals and objectives based on those priorities. This is somehow our fourth cycle of doing this. So this whole process started in about 2010 with the passage of the Affordable Care Act. There were some IRS requirements set forth in that. That required hospitals to maintain their nonprofit status. And so Anne with Barry-Eaton and her counterparts at Ingham County had some discussions and sort of moved forward with creating the Healthy Capital Counties process as it is now. It certainly changed over the 4 cycles, but a lot of the skeleton of it and the outline of it is still there, and it's a great process. We're happy to carry it forward. And then so prioritization. So this is kind of the last piece of the assessment cycle. So after we've collected all the data, we have put it into a report, which hopefully you've seen a little bit of. And then based on that, we invite people from the community and stakeholders to come to our prioritization meeting. At that meeting, we have discussions about what we want to prioritize as a community. We had 17 different priority areas or groups, so we take the individual measures. So we have real specific data points that we kind of group together where we can to make these larger categories so that we can, we don't have to be so specific and so prescriptive. We want, efforts in the community to be able to be included in our CHIP. So we wanted them to be broad so that we're not saying, we don't have to reinvent the wheel here. We want to be able to do it that way. And then when people vote on these priorities, we use 4 different criteria. So seriousness, or how much does this specifically impact people's health? Control, like how much do we as the community have to control like the issue, or how much capacity do we have? And then capacity, well, capacity is our resources really in the community. And then catalytic is how much does that one specific thing impact the other things? So kind of those upstream things that can affect everything else. Our 17 categories are listed down there. I won't list them all off, but the ones you see bolded were the ones that were selected in the previous cycle. And then this time, we selected healthcare access and quality, community safety, behavioral health, and affordable housing. So we have 2 new ones this cycle, which is exciting because we had a lot of the same ones tend to appear in these sorts of things. So we're excited to have some new areas to work in and look forward to developing some strategies to go into those areas. This is just a quick little look at what our publications had looked like. So this was our 4th one. That's all the way on the left there under 2021. So hopefully you've seen them at this point because they kind of have shaped what we're doing today and how we are going to be addressing our CHIP. Now I'm going to shift a little.
Oh,
Go ahead.
sorry, Chris. I just wanted to say if anyone needs a copy of the new one, you can go to healthycapitalcounties.org and it's available to download there.
Yes, it should be on the front page. Nice and easy to get to. Or if that doesn't work, just email me and I can get it to you as well. So now I'm going to shift a little bit and just kind of go talk through some of the data that got us to where we are and why, kind of why people chose the priorities that they did. So first, for access to healthcare and quality, the uninsured rate for this last cycle. So this is data from 2019. As you can see on the graph itself, there's a pretty good amount of variation based on kind of sub-county geographies. So City of Lansing has the highest rate of uninsured adults, while East Lansing has the lowest. And then kind of Clinton County, Eaton County as a whole, kind of in between there. But as always, anybody who's uninsured, at least from a public health perspective, we feel is, probably too many. So this is one of those areas that people tend to keep focusing on cycle after cycle, because unfortunately, even improvements don't get us to quite where we want to be at this point. Another area that stood out in the data was the preventable hospitalization rate for diabetes in adults. So this is per 10,000 adults. And as you're seeing here, it's pretty much increased almost every single year, except for that one little time in Eaton County in 2019, which, after the Affordable Care Act came out and all those other things, you would hope to see kind of the opposite trend there. But unfortunately, those are increasing. There is a interesting kind of trend here for the percent of adults who do not state they do not have a personal care physician or somebody they consider their own doctor. So you can kind of see there in Ingham County on the right, after the passage of the Affordable Care Act in 2010, that number took a huge fall, but unfortunately has been increasing since. In the other counties, it's kind of remained, kind of flat, maybe a little bit of an improvement, but still, at least for Eaton County, it is above what the rest of the state is seeing, with Clinton County being kind of right in line with the rest of Michigan. So we do know that having those relationships with your primary care physician, somebody you're seeing frequently, is an important thing to address in health. So that is why we included in the report. In terms of community safety, we are looking at rates of violent crimes per 100,000 persons. I think looking at this, nobody in the area should be too surprised. Clinton County coming in at the lowest for all 3 years, Eaton County a little bit higher. And we know there's an issue in Ingham County, which is why folks decided to really focus on it this year and include it in the CHIP, whereas in past years, they have voted for other things. To shift to behavioral health a little bit. So these are questions from our own behavioral risk factor survey. So that is something we do once every 3 years. So we're about to start the 3rd year of our survey. So we will have fresh data for this hopefully sometime next year. So it's a little bit out of date, but it's still good data. So you can see kind of we've had that increasing trend. The only reason it hasn't stayed high is because that second year in 2011 to 2013, there was a wording change in the survey that we reverted for the next cycle. And you can kind of see overall those rates continue to climb. So an important thing to address. To give a little bit of a different perspective, we were able to break this out by race and ethnicity for this cycle. In most of the geographies. So what you're seeing here is the data that's available. So for white residents, Black residents, and Hispanic residents. And you can see there down at the bottom in Ingham County, Hispanic residents certainly reported a much higher rate of poor mental health days, which is 14 or more poor mental health days per month at the time of the survey. So you can see there's a pretty big gap there. And that also applies in Clinton County as well. So it's much higher than the white residents there, which is certainly an interesting breakout compared to what I had seen in our data in previous cycles. For affordable housing, so this is folks who are spending more than 1/3 of their income on total household costs. The data here is maybe a little bit deceptive. So we do still see that it is elevated. So folks in county, especially in the more urban areas, are spending a higher, almost 3% or over 30% of residents are spending more than a third of their income on housing costs compared to the other areas. What's not shown here that was important in the decision-making process this cycle is COVID. So once COVID came around, all sorts of housing issues and other things popped up that aren't necessarily reflected in the data, but still were important enough that it made it to our priority list when folks were voting. So our key findings, just kind of a brief recap of what I had already discussed. So the rates of the uninsured adults have decreased a little bit between 2017 and 2019, with some real variation between the different sub-county geographies. The rates of preventable disease, diabetes, hospitalizations have generally increased since 2013. The urban areas have the highest rates of residents living in unaffordable housing. Rates of violent crime increased in Eaton County and have continued to remain high in Eaton County when looking between 2017 and 2019. That percentage of folks who overall spending more than 30% of income on housing has decreased, but especially in the city of East Lansing, almost half of folks spend more than 30% of their income on housing related costs. And those percentage of adolescents experiencing symptoms of depression in the last year was higher in the Tri-County area compared to Michigan, and there were also notable disparities in race and ethnicity. And with that, I would like to turn it over to Janine. She's going to talk a little bit about kind of the CHIP process and take us forward from there. So Janine, just try to share your screen and see if it takes it from me. If not, I'll stop sharing.
Thank you. Okay, so this is my screen here. Can you see it? It should say
Yes.
what's next. Okay, great.
Yeah.
So
So you just want to start I think you want to just make it presentation mode.
yeah.
So it'll be bigger.
Okay. View.
I think you have to go to the ribbon thing that says slideshow.
Yeah. Slide overview. Oh yeah, slide master. No.
Nope. At the very top row of words where it says slideshow next to review and view.
Okay, yeah.
Above notes there. Here we go.
Haven't.
And from current slide.
And then from current slide.
Okay, from current slide. All right.
Ta-da.
So starting with the CHIP process, community health improvement plan, and so what is a CHIP? The community health improvement is a process to identify and address the health needs of communities, and this is recognized by the Center for Disease Control, and they have a website. If you want to go to the CHIP, I will include the website in the chat later on. It becomes a CHIP when we add specific goals, objectives, activities, and ways to monitor improvement. Both process and outcomes are very important for the CHIP process and for accreditation. It's a tool that describes the visions, goals, objectives, and activities done by partners within a defined time frame to address community-chosen priorities rooted in a rigorous assessment process and is evidence-based. It's a tool that fosters collaboration across sectors, across counties and units, and encourages accountability. It's also required by the Public Health Accreditation Board to ensure accountability. The essentials in the CHIP process, ongoing communication among stakeholders is established and maintained throughout the time of implementation. And with the results of each phase of the CHIP process, as well as key messages that build public and political support for action, are shared with the community and public. So it's very important to keep transparent and sharing throughout and including the evaluation. Based on our previous cycles, I've done this, as I said, like 3 cycles so far, and we realized that the questions your organizations and units need to ask themselves when considering priority strategies are like, for resources, how will our organization maintain support and resources for the activities that you are including in the plan? Sustainability infrastructure for coordinating the specific selected activities. What are the sustainability questions or that you have addressed in choosing your strategies? Does the proposed plan include policy, system, environmental solutions? Because we know that when we include higher level framework that address the social determinants of health, we are more likely to include sustainability. Are the proposed activities evidence-based? So we usually encourage organizations and collaboratives to add links to where, like, the evidence-based related to the strategies or activities that they are proposing. I think, Chris, you went over this before. So from the data, and we go to the chip, and the chip will include formulating goals and objectives, making sure that we have measures that for the indicators that we are including, and the accountability. Like in the past, what I have done is, like, every 6 months, I would check back with the organizations that submitted strategies, and they would fill out a very brief form that about the updates of where they are in that strategies that they have selected. Of course, when we have collective efforts, they always lead to collective successes. And for this cycle, we are happy to present 2 of the stories of success. One related to the obesity priority through the Sugar Smart Coalition, and one
FaceTime
related
video.
with
FaceTime video.
and one related to sorry, this is my son, my grandson. My grandson just moved to a new apartment just
FaceTime
last
video.
night. So I'm sorry. I have to close this. Okay. So yeah. So so I transition now to Jane Kramer, who will be presenting for the FaceTime who will be presenting the Sugar Smart Coalition, the objective for obesity priority. Thank you. Jane?
Thanks, Janine.
Yeah.
And I'm going to share my screen here. Could you enable?
Yes.
Okay.
I'll disable my screen sharing here. Okay, here you go.
Okay. All right. Yes, I'm here on behalf of the Sugar Smart Coalition. The coalition was formed in January of 2020 out of a grant from the Harvard Law School Food Law and Policy Clinic. Just a second. Sorry, the snow day has kind of upended everything, but anyway, so we started in January of 2020, and our mission is advocacy, education, equitable practice.
Just want to, so folks aren't able to see your screen, so
oh, I'm so
let me see
sorry.
if I can. There we go. Better.
Is that better?
Yep.
Okay. Okay. So we're the coalition is committed to advocacy, education, equitable practice, and policy that improves healthy food and beverage options and choices. And you can see we have members from the private, government, nonprofit, and academic sectors. And the CHIP strategies that we were looking at were, We wanted to research and identify local and state policy options for reducing sugar in the greater Lansing area, build a local capacity for policy change and possibly implement those action plans, and then develop educational materials and possibly draft sample legislation and regulations. So we had at the beginning, actually before we formed the coalition, we had a community forum with the Harvard folks and kind of talked through some of the strategies that we might use to address the overconsumption of sugar. And we came up with some priorities. These mostly are rollovers from 2020, because due to the pandemic, we've had to kind of shift things. But our main priorities for this year are a healthy drinks, healthy kids messaging campaign for Head Start, healthy vending, healthy default drinks on restaurant kids menus, and then we just launched our Facebook page. So, and I'll talk a little bit more about this in just a second, but basically we have these 6 committees and they're all connected, but we'll walk through a few of them. The Nutrition Guidelines Committee was formed early on, and they have defined nutrition standards for our various initiatives. So the work is ongoing because each initiative has slightly different needs when it comes to the guidelines. And then we also have a Healthy Vending Committee, and we're working to pass healthy vending policy for Ingham County properties. We have assessed vending machines at the Ingham County Human Services Building and at Forest Community Center using the guidelines that our committee created. And we created a healthy vending toolkit for Ingham County, which we presented to the Board of Health and the Human Services Committee. And we're grateful that we've received support from both committees. So now we're working with the purchasing department at Ingham County, and we'll be drafting our final policy recommendations to share and present with the Board of Commissioners. And then another kind of subcommittee of this committee is that faculty from Grand Valley State University and MSU are working on a campus vending project. So they're hoping to conduct a focus group with food and beverage managers at Michigan universities to learn how and if they address food insecurity among their students through healthy vending practices. And then kind of a newer initiative is that we're starting to create a toolkit for 4-H participants to assess the vending machines and sugary drink marketing practices at their high schools across Michigan. So that is a healthy vending initiative. Our Healthy Drinks, Healthy Kids Committee is developing a community-informed Healthy Drinks, Healthy Kids messaging for Head Start families in Ingham, Clinton, Shiawassee, and Eaton counties. And so we partnered with faculty and students at MSU, GVSU, and Wayne State to conduct surveys. We have over 300 participants and are now using the results from those surveys to develop our materials for a 6-week messaging campaign. And it'll run April 4 through 13. And it'll be following SNAP-Ed requirements through Michigan Fitness Foundation grant and through MSU Extension's SNAP-Ed program. So we'll be sharing it with 20 Head Start locations through social media, flyers, and posters. And MSU will also be offering a 6-week virtual parent nutrition class. I'm sorry, I'm going really fast, but I know I only have 5 minutes. And then we're working with Head Start on a sustainability plan so that they can replicate this over the next few years. And then our Healthy Defaults Committee is exploring policy for default drinks on restaurant kids menus. I don't know if you've seen this, but these are policies that require restaurants to include only healthy beverages on kids menus, but parents can also offer or order sugary drinks. It's just that they are not listed with the kids menus as a way to make a healthy choice the easy choice. So we did a survey of online kids menus in 4 cities, And then we are hoping to work with 1 to 2 local restaurants on making their changes to their kids' menus voluntarily and encouraging them to join the National Restaurant Association's Kids Live Well program, which has a healthy default menu policy written into it. So, and then lastly, like I said, we just launched our Facebook page, so please like and share that. And we're hoping to share more about our coalition this way, and also we'll use this as our a way to disseminate our materials for the Head Start campaign. So I think that's it. Sorry again for going so fast and for the noise in the background. Thanks, Janine.
Janine, I think you're muted.
All right, thank you, Jane. We'll take it back, and Joel will be our next presenter. He sent me the material. So Joel, do you want to share, or do you want me to just go over what you sent me?
I can share a screen, and if you didn't have it incorporated into the PowerPoint, I can just share what content I did share via email.
Okay.
But I'd like to just back up a little bit, just to give some context. So we've had the Behavioral Health Council in operation for several years, and I facilitate that. It's an outgrowth of the Capital Area Health Alliance's mental health partnership. And so we've kind of continued that frame and moved into more of a community planning initiative around behavioral health, mental illness, substance use disorder, and intellectually developmentally disabled populations. And so we're focusing on behavioral health as a whole. We're looking at, we've identified goals, objectives, and strategies, and I can share briefly just the action plan that has kind of been connected to the CHIP, which is great. I love that. I really appreciate that. That's goes a long way in aligning our efforts, and provides an opportunity for other resources, other stakeholders to connect to this work. So this is the 21-20 through 2024 action plan. We had one prior to this that also aligned with the CHIP, but there's our vision to promote behavioral health services inclusive of those populations, those supports, the access to care, training, education, and outreach in the Tri-County area. Our overarching goal for these objectives is to increase number of individuals that access behavioral health services inclusive of those populations. So really trying to align a variety of different things. We've always had a disconnect with substance use disorder services being separated from mental health services and IDD services. And what we want to do is make sure those are aligned, those are complementary, and those are communicating in different ways, because those referral sources and those individuals seeking care are usually impacted by multiple issues. Co-occurring disorders is a major issue and a major concern, and that's where a lot of folks slip through the cracks, where they may be receiving mental health services, but they're not receiving services for their SUD or substance use disorder, so or vice versa. So those are the overarching vision and goal. And we talk about the objectives. I won't get into this specifically because I want to speak to some of the successes that Janine asked me to speak to. So let me stop share. And Janine, do you have slides prepared, or should I just share the content via the email?
Well, yeah, the slides that I have are the ones that you sent me. So
that's great. Yeah, if you can advance the slide, I'll speak to that.
Yeah.
So thank you. That's great. So this is some of the highlights again that we've been focused on. I talked about the overarching goal. This specific objective that we're going to reference is around expanding behavioral health evidence-based interventions and trainings that promote access to services, reduce stigma surrounding behavioral health issues, and improve community health and well-being. If you could advance the slide. And this really, we do a lot of things, and our networks and our stakeholder partners provide a lot of different trainings and surrounding mental health first aid, surrounding QPR, question, persuade, refer, suicide prevention training. So there's a ton of that activity going on that's really been positive. But I wanted to speak to one thing specifically in here is surrounding the screening platform. So many of you are likely aware or are partnering on this activity, but the behavioral health screening platform continues to increase screenings completed, visits to the platform, and the completion percentage of folks visiting this screening platform. So what this is a behavioral health screening platform that provides validated, reliable screenings on a variety of different issues, depression, post-traumatic stress disorder, eating disorders, alcohol use, anxiety, bipolar disorder. We also have a wellness screen, an opiate use screen, which is another level, which I'm really happy with. So the screening platform allows someone to check in on their mental health and well-being. They're quick. They're a way to determine if they need professional assistance and professional help. They're educational, not diagnostic. They're not a formal diagnosis. They're not a formal assessment, biopsychosocial assessment. Those take hours, an hour and a half to do. But these are done within 2 minutes. You can take multiple screens for anything that you're considering is an issue. You can also take it on behalf of your teen. So parents, caregivers, grandparents can access an adolescent depression screen and on behalf of their teen. So really important there. We're also working on expanding and having a youth screening specifically, and also the potential to reach out to folks that connect to this screening and provide some opportunity to not be anonymous, but then to have my recovery coaches reach out and assist them with accessing care. So there's a lot of opportunity here. Universal screenings are the way forward in my mind to bridge the gap of people not accessing services, the stigma around behavioral health issues, and just the awareness of resources and education around behavioral health issues. So we also provide this opportunity to connect to our screening to any agency, any association, any business. We have many partners that put this on their website. DeWitt Public Schools, Grand Ledge Public Schools. There's other public schools that have it in their counseling section. There's other agencies and institutions that have this on their websites, which is great. It's a link, a hyperlink within a button. So that's available to anyone. And here's the data as far as the FY 2021, 1,039 screenings completed, almost 1,600 visits to the online screening platform where they can get resources, information, education, and a pretty high completion percentage. So 65% completing percentage of those visiting the site and actually completing a behavioral health screen. There's the link. And I think for me, there's just so much more opportunity for this to grow. And those numbers are even being surpassed for this year already. We're averaging anywhere from 40 to 60 screenings per month. And that's with, again, no paid advertising or very little over the past 5 years, 4 or 5 years that it's been in place. Next slide, please, Janine. And then the second item briefly is that surrounding objective 4 within our plan, which is develop a tri-county communications plan to promote access to services, reduce stigma surrounding behavioral health issues, and improve community health and well-being. You see the themes there consistently throughout. We are trying to promote access to services, reduce stigma, and improve community health and well-being overall. The success is surrounding the utility of the social media and CMHA CEI, specifically Facebook toolkit across stakeholder groups to promote access to behavioral health services. So within this Facebook toolkit, it's kind of a media packet or a social media packet where we have done all the work around behavioral health related posts, content, infographics, resources, training opportunities, our access line, things like that into social media posts that can be copy and pasted. It's basically the easy button for communications departments. And what we've done is provide specific information and posts around our behavioral health services and our partner and provider network services, trainings, resources, self-care, community supports, and we're looking to enhance psychological wellness and resilience and instill hope and inspiration. So we do a lot within this Facebook toolkit. It's on our publications tab on our website. Anyone can utilize that, share it with your communications department, and have ready-made vetted posts for your networks, your community, your population you serve via your social media, your Facebook pages. So that's been really beneficial. We've shared it throughout the state, and other areas are able to take those and utilize that and share and tag us. And we're really happy with the outcomes around that, because what it does is gives other referral sources, referral agencies, other people in the behavioral health world an opportunity to promote wellness, to promote access to services, to promote mental health first aid training for their staff or populations. It just does so much to provide it on a platter for other agencies that may not have a communication staff, a public relations staff, or a Facebook social media staff specifically. So questions, comments, feel free. I also wanted to say I work with the Sugar Smart Coalition. I'm so glad to be a part of that. And their success has been really amazing. And Jane, excellent job. Janine, everyone else involved. Kudos to you guys too. It's great.
Thank you,
Thanks,
Joel.
Joel. Janine, I'm going to take the screen back. So I have a couple slides that I'm just going to kind of skip over. We're going to go right to our breakout rooms. So I'm going to go over those just for the sake of time. So what we're going to do is we're going to break out the breakout rooms by priority. So when we get in there, we're going to have a chance to review the goals and objectives. So that's our main thing today. They'll be highlighted in yellow. And then, so once that's done, the area leads will be taking notes and changing them as they need. And then when they're done, I would ask that any changes that are made, please send them to me afterwards. So when we get in there, these will be our discussion leads. So they'll be the people driving the conversation. So again, what we want to do is to talk about the goals and objectives. Do they seem appropriate based on what we want to have them? We want to end up with maybe around 3 if we can, because we don't want it to be so broad that we include everything. We want to find the things that are super important to the community at this point. Again, make note of any edits, try to come to a consensus. It's okay if we don't today. We will have another meeting in about a month where we will have those discussions again as well, where we can really hone in on that. And specifically for discussion leaders, when you get in there, make sure you can, if there's a record button, record it so we can have that recorded on your end as well. If it saves to your hard drive, just send that to me afterwards so I can upload it later and we can have a full picture of that. For the breakout rooms, these are the ones we're going to do. So I'm about to open them up in just a second. Let's see where they are. Breakout rooms. Okay. So these are the areas you want to go. So in just a second, I am going to create them and open them. So everybody, based on your area of interest, please head in there. Once I see most people go in, I will join in the healthcare and access equality, and we'll have somebody in the main area in case you accidentally join the wrong place to get you where you need to go. So take a minute and head on into the rooms.
So when that pop-up shows up, you need to scroll down to the very bottom, and that is where the links are, and you'll see a blue box that says join.
Thank you.
So Nikki wonders which room to pick. I would say go where your interests are most aligned, or you feel it's most relevant to the population that you serve.
Yep,
Or join
exactly.
one that you don't know anything about and learn more about it. That is also cool.
Yes. Okay, I am going to hop into my room. So Sydney or Anne, if you hang out here for a couple of minutes, just make sure everybody gets where they need to go. I would appreciate it. Message me if you have any issues.
I don't see. You ended that too soon. We were still going.
I know. I already saw what time it was. I was trying to let people get as much as they can in there. Instead of popping up our slides, I'm just going to quick recap what we're going to expect going forward.
Okay.
So first, thank you for everybody coming. In the future, we're going to have meetings specifically devoted to those conversations, so you'll have plenty of time to do that. The next meetings are going to be split kind of into two. To let the health departments, everybody have more focus, give everything the time it needs. So on Fridays, healthcare access and quality and community safety will meet. On Wednesday, affordable housing and behavioral health will meet. There'll be reminders sent out ahead of time. So we'll make sure everybody's registered and reminded that those are coming up. And if you need to contact anybody, you can always reach out to me. My name will always be on the email, or Janine with Ingham County, or Rex for Mid-Michigan. So that's all I have. Thank you everybody for sticking with us. I appreciate it. And I know we're asked some of the health department folks to stay on just for a couple minutes after, just to have a quick debrief. So thank you everybody for coming.
Yeah, and great engagement in the meeting today, everybody. Thanks so much.
Thank you. Have a good weekend.
Thank you.